friends, Dr. Marta Perez here, and you're back for another episode about the COVID-19 vaccine and reproductive health. We're gonna cover the frequently asked questions, all submitted by you, about trying to conceive infertility, being pregnant, breastfeeding, and the COVID-19 vaccine. I'm really excited about recording this. My last video on the COVID-19 vaccine and pregnancy and conceiving and breastfeeding got so many views, and I got such a good response of being really helpful. So I'm hoping this one is really helpful too, since everything moves really fast and there's a lot of questions that come up even in just 2 weeks. I love making these videos so much because I can cover in just 10 to 20 minutes. I don't know how long exactly this is gonna be when I finish editing, but I can cover in just a few minutes so much more information than I can type out on my Instagram stories. So if you wouldn't mind subscribing to my YouTube channel, it will really help other people be able to find these videos and find really good information. And we really need all of the good information that we can get during this time because there's so much misinformation and there's so many people that have so many questions, and I want to make sure they feel empowered and have their questions answered. And if you found this video for the first time, I want to encourage you to go check out my first video. I made that first video a few weeks ago. It covers a lot of the baseline in the background about, immune status in pregnancy and the COVID-19 vaccine and mRNA, et cetera, et cetera. And so that is in the little banner above, and click on that, or you can wait to the end of this video to go back to it if you want. The second thing is that I'm all about giving you resources. I love that you trust to listen to me, and I take that responsibility really seriously, but I want you to have the resources that I use, that I got my information from, so that you can read them, you can give them to family and friends. It's all about having access to resources. So I'm gonna spend just as much time as I spend recording and editing this video putting together the most epic show notes ever. I'm gonna link everything by topic: fertility, pregnancy, breastfeeding. I'm gonna link everything there so you can go to those links and find the documents that I'm talking about or the websites that I'm talking about from legitimate organizations. Also, I have tons of really smart friends and they've made awesome content too. They're kind of like getting a second opinion, or their specialty is somewhat different. So you can find resources from them as well. All right, here's what you're in for today. We're gonna talk about fertility and trying to conceive, then pregnancy, and then breastfeeding. Finally, I'm gonna answer questions about my own receipt of the COVID-19 vaccine at the very end. I have some really important final thoughts at the end, so I really want you to listen to them. If you're short on time, just press 2 times speed or whatever, or just come back to me later. But I really want you to hear my message right at the end. So with that being said, I do have an intro, which is, if you are an American, whether you're pregnant or you're breastfeeding, your choice to receive the COVID-19 vaccine is a choice. All of the professional organizations that represent OB-GYN doctors have said it should be your choice. The FDA and the CDC have said whether or not you receive the vaccine as a pregnant or breastfeeding person should be your choice. I don't want anyone telling you that you either have to get the vaccine or that you absolutely should not get the vaccine. This is going to be something that you should decide for yourself based on the resources you access and your conversations with your healthcare provider. I wanted to cover that because if you are not pregnant or breastfeeding, then you are the population that the huge trials for these mRNA vaccines were done in. You are an adult without these 2 conditions, and I want to encourage you to get the vaccine if it's offered for you. If you are pregnant or breastfeeding, no matter what choice you make, I hope that you're encouraging your family and your friends to get the vaccine if it's available and when it's available for them. We really want as many people protected as possible, and it's really exciting that we can. So that's my quick plug for that. Okay, so the first round of questions I saw was about how the vaccines actually work, or the differences between the 2 vaccines. So let's talk about that. I love focusing on reproductive health, and I'm an OB-GYN. I've read a lot about how the vaccine works, and I'm gonna summarize for you, but I'm also gonna give you the resources for people who talk a lot about the vaccine, and that will be in the show notes. Difference between the 2 vaccines. There's the Pfizer and the Moderna vaccine. They're both mRNA vaccines, and they work very similarly. They have some slight differences, like the little packaging they're in, how they're frozen, and the length of time between the first and the second injection, but they're overall extremely similar. They're both very safe and have very high efficacy. They're just really cool. So if you're trying to make a choice between one vaccine or another, in my opinion, I don't think there's a reason to choose one or the other. If you're a pregnant or breastfeeding person who's trying to make a choice between one or the other and wondering which has more data or which might be safer, in my opinion, I don't think there's reason to do one or the other. As far as how these mRNA vaccines work, so this type of vaccine is mRNA surrounded by a little lipid particle. It's injected into you, the lipid particle goes away, the mRNA is used to make proteins, it does not change DNA, and then it's gone from your system in only a few hours. So it's incredibly fast acting. The other thing about vaccination is that vaccination is able to create a better immune response than having the infection itself. And you don't have that risk of side effects and severe illness from COVID. COVID's associated with all these adverse outcomes like long-term COVID and serious illness, and you get to avoid all that with the vaccine. So that's background on those vaccines. There are different types of vaccines besides mRNA vaccines that are being trialed. There's a huge list on the New York Times about all different types. Find that in the show notes, and we're gonna move on to the special populations and concerns. I want to cover the trying to conceive population. So if you are a healthy adult who is not yet pregnant or breastfeeding, then you are the person that was trialed, and the trials were great and very reassuring about high efficacy and low adverse events. So I would encourage you to get the vaccine if it's offered to you. But this is a really popular topic that we're gonna break down even more because I'm just getting so many questions about it. Does the vaccine have any links to infertility? The answer to that is no, we have not seen any proven links to infertility. I'm gonna direct you to the fertility subheading down in the show notes where I'm linking Dr. Natalie Crawford, who is a reproductive endocrinologist and infertility doctor, who has a video debunking a viral misinformation post about infertility, and to comments from the American Society of Reproductive Medicine, which is the group of doctors who do IVF and fertility treatments, and their recommendations there as well. So there is not a concern about fertility and the vaccine. Is there a recommendation to wait a certain amount of time from getting vaccinated to conceiving? There is not a specific concern, and there is no recommendation for any amount of time that somebody should wait between getting vaccinated and getting the vaccine. Should someone get the second part of the vaccine if they conceive before the first one and the second one? The American Society for Reproductive Medicine says that these people should be offered the vaccine. For people in the fertility community specifically, the ASRM guideline says exactly, I'm gonna read it off because I like their language. Patients undergoing fertility treatment and pregnant patients should be encouraged to receive the vaccination based on the eligibility criteria. Since the vaccine is not a live virus, there is no reason to delay pregnancy attempts because of vaccination administration or to defer treatment until the second dose has been administered. My quick caveat is that I don't see any concern there, but if you are someone who is going to feel stress or concern, then perhaps you don't conceive between the window. Now, that's not based on science, that's based on you and your decision making and your level of anxiety and comfort and your choice, since you would be pregnant for the second one, which means that you fall into the category of we don't have the trial data, so it's all theoretical. So if you feel like that's gonna be a sticky situation for you, do what's right for you. If you feel like this is cut and dry and you would get the second one anyway, no matter what, then I have no recommendation for you to delay in that window at all, because I don't have theoretical concerns, but you would fall in that no data category for the second one. So I hope that answers that question. All right, we wrapped up trying to conceive and fertility and the vaccine. We're moving on to questions about pregnancy and the vaccine. A big question I get is there a specific trimester of pregnancy that I should get the vaccine? Should I wait to a different trimester based on the one I'm in? If I'm first trimester, should I wait till second? If I'm third trimester and I'm about to have the baby, should I just wait till I'm postpartum? And I want to reiterate again, we don't have the data based on the trials about which trimester might be best or if there are different risks in different trimesters. So this is just an individual decision based on what you're offered and when it's offered and everything else. Some people have been concerned that there could be a theoretical concern with giving the vaccine in the first trimester because will it cause a fever? Some people are getting a fever when they get the vaccine as a side effect. About 14% of people from the Pfizer data, so not a lot. The fever risk with actual COVID infection though exceeds 85%. So if your goal is to avoid a fever in the first trimester, the vaccine may be a better idea than actually getting COVID. So depending on how much COVID is a risk for you, that may influence that. The other thing about fever is that fever we thought could be associated with birth defects, but newer research has come out showing fever is likely not associated with birth defects. So the fever issue may not play into your decision at all. And what are the professional organizations saying about this? So the experts, and I agree with them, are saying that the theoretical risks are low and that trimesters should not be a specific exclusion, or there is no specific recommendation about which trimesters. I personally would not hesitate to get the vaccine in the first trimester because it offers you a great level of protection for ongoing pregnancy, which we know to be high risk. But if you feel like you'd rather wait till you're outside the first trimester, that's okay too. Maybe you are able to get a vaccine before you get pregnant, or maybe you wait until the second trimester if it's available to you. I want to validate your choices as being the one that's right for you. I got another question about, I'm in the third trimester. Should I just wait until I have the baby to be postpartum? Again, totally personal choice based on your individual risk scenario. So there's no recommendation for different trimesters. If you've decided in your mind that you want to wait for a certain trimester, that's fine, but we don't have the data to say that any is better or any is worse. So in that light, make the decision that's right for you. Next big topic is about the vaccination and breastfeeding. So quite a few topics within this topic. One is that, again, breastfeeding and lactating people were not included in the trials, so we don't have data exactly about it. However, this has an even lower theoretical risk. As I just mentioned, the vaccine itself degrades in the human body like super fast. And when you're thinking about theoretics, it's unlikely the particle could even make it into breast milk. And even if it made it into breast milk, again, it goes away pretty fast. Even if it did make it into breast milk and then into your baby's mouth, probably your baby's oral and gastric breakdown proteins would probably break it down there. So there's even less theoretical risk. I like this quote from ACOG, which says, "Theoretical concerns regarding the safety of vaccinating lactating individuals do not outweigh the potential benefits of receiving the vaccine." So what are those potential benefits? Well, obviously protecting you, because you are super important and we want to protect you from severe disease from COVID. But everyone's always thinking about the dyad together, right? Like the pregnant person and recently birthed person and the baby, fetus or baby. So in a second, I'm gonna talk about antibodies and exactly how we're protecting the baby. I got a few questions about pumping and dumping. Again, I find these theoretical concerns very low. There is no recommendation as far as any amount of breast milk expression or timing or dumping or anything like that. And then for breastfeeding, I got a lot of questions about breastfeeding children of different ages and what degree of protection that would be. And I just don't really have the answers for you about that. I will keep you updated on breastfeeding science and studies doing on human breast milk about how much antibody is actually passed. But then there's the real world question, which is how much is the baby actually protected itself, which would take years to find out. I will say that the older your child is and the more they're getting nutrition from not just breast milk, either because you're doing breast milk and formula in the beginning or because they're eating food, then there's gonna be a decreasing levels then. So the answer is we just don't know about that. I mean, certainly you're unlikely. Breastfeeding is great and a breastfeeding relationship is wonderful for people who have it. And I would never discourage someone from breastfeeding by any means, but I don't know the level of benefit. But don't forget though, when you're talking about your children, whether or not they eat breast milk is the fact that by protecting yourself from really severe disease, you're helping your children. I mean, if you're not in the hospital, if you're not really sick, you're gonna be able to provide better care for your child. Okay, now we've covered fertility, we've covered pregnancy, and we covered breastfeeding, a few general topics that apply to everything. I got great questions about, well, how does it protect the fetus or baby? So let's go over that. There's very low likelihood that this vaccine, based on how it works and how it degrades really quickly, could cross the placenta or could cross into breast milk. It's not like we're giving the baby or fetus the vaccine. What we're doing is giving them antibodies. So the pregnant person or lactating person's body does all of the work and the baby gets to reap the benefit. So your placenta does give antibodies to your baby. This is why we give pregnant moms Tdap during their pregnancy. It's to protect their babies from pertussis. This is why we encourage breastfeeding for those who that is possible and the choice that's right for them, because it can confer immunity and decrease the amount of colds and infections in young infants, because antibodies pressed from breast milk onto babies. So it's the antibodies or the product of what your immune system makes after receiving the vaccine that is the actual thing that we think is going to help the fetuses and babies. As I mentioned at the beginning, we do think the amount of immunity from getting the vaccine is much better and higher quality than the immunity from having had COVID, which is why people who have had COVID in the past are recommended to get the vaccine. The next question was really one I loved, and it was, hey, I want to help participate in this science, especially the healthcare workers that are being offered the vaccine in the first tiers who might be considering pregnancy, pregnant, or breastfeeding. They want to really help science so that the people who are in much later tiers have a little bit more data to go on for them. And I have gotten some information about research studies that you can participate in. I actually linked them over on my Instagram stories. So please head there if you're interested in contributing to science to help us learn more. One question I got is, when will I be offered the vaccine? If you take pregnancy out of the equation for a second, you're gonna fall somewhere in a tier based on your occupation or your medical conditions, et cetera, et cetera. With pregnancy in the picture, we haven't seen information that pregnant people who are otherwise healthy would be prioritized above or below other people who are otherwise healthy. So I don't think in the prioritization landscape of timeline, you're gonna see a difference for pregnancy or breastfeeding, because again and again, we're just seeing these people can make a choice. I do think it would be cool, since pregnancy is a vulnerable situation, if we could bump them up a little bit to the other people who have like health problems and vulnerabilities, but TBD on that. I'll update you if that changes. We're really focused on that first tier of healthcare workers right now. So I don't know exactly a timeline for you if you're someone who's like otherwise low risk and would be in a lower tier and like maybe late spring or summer. Okay, I just went through like a bunch of facts and a bunch of information, but now I'm going to slow down and give you what I thought was the most important information of this video. And that is validating that this choice is easy for some people and hard for other people. And that's okay. Choices can be hard. Some people might see the decision about whether to receive the vaccine and when to receive it when it's offered to them as something that is black and white. It's either a, oh no, I don't want it, or it's a, oh yes, give it to me right now. And for most people though, it's gonna be gray. You're gonna feel like these are the reasons I wanna get the vaccine, and these are some of like my hesitations about getting the vaccine. And that's fine. Rarely in life are we ever totally black and white about our choices, right? Like I'm not even black and white about what I wanna eat for lunch. And it's totally okay to have very mixed feelings going into the choice. That's why I said so many times, and I gave you so many options, that I'm gonna support you no matter what your choice is during pregnancy and breastfeeding about making the choice or these little other considerations. I wanna give you resources to help you make the choice, but ultimately the choice truly is yours. And I support that it's a hard one to make, and that's okay. I just want you to feel supported. I want you to know that it's okay to make a hard decision. It's okay to not feel 100% about your decision, but make the one that feels like it's 60% right for you. And it's okay to even change your decision a little bit. Maybe you had decided not to get the vaccine and then you did more research and decided to get it, but there's still a little bit that's hesitant to you. And we just have so few answers and so many individual situations that there's never any blanket answer I could give you. And over time, it's possible the decision may become easier to make. Perhaps when more data comes out, we're gonna have a lot more clarity, and I do think we will, although I do think it's going to be months to years. So as a part of recognizing that this choice may not be easy, the very last question that I got lots of is, are you gonna get the vaccine? Because I am 34 weeks pregnant and I am a healthcare worker who is offered the vaccine in the first tier. And the answer to that is that for me, this choice was easy and it is black and white, and I am getting the vaccine. I am getting the vaccine as soon as I can. It's been a really long pandemic pregnancy, and this feels like a lot of hope. Yes, I don't know if there will be long-term negative effects, but I know that there are really scary effects of COVID in pregnancy. I've researched the science around this vaccine, and it is not just, to me, not worrisome. It's like exciting and so cool. To me, I don't have any hesitation, and it's black and white, but you're different, and that's okay. And it's okay if your decision is different than mine. When exactly am I getting the vaccine? Well, I should find that out in an email literally any minute. My institution is going by age. And so, the 60-year-olds got it first, and then the 50-year-olds and the 40-year-olds. And the 40-year-olds were scheduled to get it Christmas week. They got their email yesterday. So me, I'm in my 30s. I'm expecting an email today or tomorrow, and I'm hoping that I can get it before the new year, which would truly be the best Christmas present that I could receive. You know what? To be honest, I'm thinking about going and like belly bumping some 60-year-olds out of the way to get further up in the line. I'm just kidding. I'm not gonna do that. But you know what? It's tempting. So again, please take a look at the show notes. I'm extensively populating them with resources. Please subscribe and like this video so that more people can find good information online about the COVID-19 vaccine and reproductive health.